Hello, everyone. This is Dr. Nicholas Roy here. I just wanted to spend probably a half hour or so discussing with you what we're going to call the nasal breathing triage protocol. This is really version 1.0. This came from the urgency that I have to share this information with the masses, not only myself and my family and my friends, but my coworkers and also our patients. So this will be the first run at it. The goal here is to provide information for everybody to use while they start on the journey of better nose breathing. Um, I'm a firm believer that most people can benefit from this in some form or another, as you will see here. So the objectives of this video is to paint a picture of the importance of why nasal breathing is so important, increase the awareness so that my staff understand what to look for with the patients, but also to give patients actionable tools to actually go and start increasing their ability to nasal breathe as they start to go out and find an ear, nose, and throat specialist or an otolaryngologist, somebody to that's an expert in this arena. But there's a lot of things that we can do in the dental world to help you on that journey. First and foremost, just kind of increasing awareness. We're going to start to increase our ability to share resources with our patients and other people out there. I'd also like to instigate a broad conversation. There are few things that I've encountered in my professional career that have as much of an impact on the quality of life of those around me than this conversation here. Over time, either through Saco River Dentistry or NECADE, which is New England Center for Advanced Dental Education, we want to have a place for people to go. We're just going to put this YouTube video up on our NECADE channel for now, but eventually we'll have an entire database of resources to help our patients moving forward. The priority here is to provide triage care. So I want patients to go home and start this process before they see an ENT. As we all know, the medical community, unfortunately, right now is suffering from long wait times. I scheduled an appointment with an ENT in September. I have to wait until February, so almost 6 months of wait time. In the meantime, there's things I could do, and that's really what I started doing for myself as I started to improve my nasal breathing and seeing the drastic improvements in my quality of life. I started to realize that much of this can be done with over-the-counter medications and other tools and techniques, which is what we're going to briefly go over today. So there's a hierarchy of care. Now, again, I'm not an ear, nose, and throat specialist, so I want to be very clear that I'm playing a very limited role in this. There are many things, many connections between nasal breathing and dental problems. So it's somewhat loosely related to what I do. With that said, I want to be very careful to articulate who I am and what my qualifications are. My goal here is to provide triage care. So in the dental office, we are likely going to identify a problem. We are qualified to screen for these kinds of issues, provide triage care, over-the-counter medications, over-the-counter tools and techniques as you get ready to find yourself an ENT. And then there's obviously dental treatment that goes along with this, TMD, oral myofunctional therapy, final treatment execution and maintenance. Those are all topics for a different day. Really what I wanted to do here is focus on what is the purpose and importance of nasal breathing, but also what can the masses do to start the process. Well, first and foremost is education. There are several books out there right now that are geared towards the layman or the patient. With that said, I think every dental professional, dentist, dental hygienist, assistant, front office team, administration, I think should read one or all of these. If I had to say which, well, they're all good. Just pick one and go. They all kind of share the same thing, that breathing is quality of life, and much of breathing has to do with our nasal health and our dental health, as you will see, and our sleep health. So lots of things are connected. I have no doubt if you read any of these books, your life would be different. So how can nose breathing change your life? Well, let's start with mouth breathing. Mouth breathing is not the mode at which our body is designed to acquire our oxygen. If we mouth breathe, there's lots of side effects. My goal here today isn't to talk about mouth breathing, but it's to provide a contrast of why nasal breathing is so damn important. And as you can see, there's lots of things here for both adults and children. How we handle these things, there's so many avenues to go down. It's such a broad topic that is really starting to catch fire in dentistry and to a lesser extent medicine. But I have no doubt in 10 years this will be mainstream. With that said, lives can be changed now, and that's what we're going to do. So specifically with my journey, posture and the soreness I have in my back, I often attributed to my occupation as being a dentist. But over the past year, I have kind of segued more into an administrative role, and I've spent less time chairside, but my back pain continued. And it just happened to be that I started to learn more about nasal breathing and its effect on posture. In a nutshell, when our nasal passageway is constricted for some form or another, for me, I just have a smaller nose. My palate didn't develop as wide as it should. I struggle to breathe. And as a result, my head postures forward, and I have what's called cervicomyositis as a result. As you can see in this image here, the redness of a muscle. There's lots of muscles in the head and neck. For me in particular, it's my SCM and my upper trap. So I spend a lot of time in pain and discomfort. I massage, I do all kinds of things after the fact, but I really haven't until recently discovered what was actually causing it. And I'm fully convinced it's nasal breathing. So as you can see, I'm pretty passionate about this one, just because I love the intersection of humanity and science, but two, also because I have suffered from lack of understanding of this connection myself. So back to this hierarchy of care, let's take a little look at what triage care would look like. Here are some tools, over-the-counter, non-prescription based methods for us to look at as we start to look at improving our poor nasal breathing. So first is nasal dilation, simply using mechanical means to increase the cross-sectional area of our nose somehow in order to increase the volumetric effect of the air that comes in. There's a law in physics that has to do with a mild increase in diameter of a tube drastically increases the volume of the substance which travels through that tube, whether it's electricity or water conduits or what have you. The point is, it doesn't take much increasing the cross-sectional two-dimensional area, surface area of a tube, that tube being our nose and our oropharynx and essentially our entire airway, for there to be a drastic increase in the ability of flow. More flow means more oxygen, in a nutshell. Secondly, if the membrane within the nose has a compromise, there's several techniques that we can use using pharmacotherapies, such as Flonase, allergy medications, whether they be in a spray form or oral form, and then nasal decongestants, which act in a slightly different mechanism of action. But the point is, we have ways of decreasing the sinus membrane, which from patient to patient may or may not be important. So a lot of this has to do with customizing the treatment plan. We'll leave that to the ENT. But we're going to come up with a very simple triage method that's going to help most people increase their breathing while they find an ENT to do a customized treatment plan. And lastly, just improving our nasal hygiene. As we all know, the nose is a dirty place. Our nose acts in many different forms, filtering out bugs, filtering out debris, dust, what have you, is one of the main objectives of the nose. Well, that stuff has to pile up over time, And if we don't actively clean it out, or if our body has a decreased capacity to do something with that, we end up getting things like boogers. Long story short, it's important for us to keep our nose clean so that things like that don't end up compromising the ultimate function of our nose. And there's different ways and methods of that. So nasal dilation, again, is the mechanical means of opening the nose. There's many different tools out there available to us, as you can see here. In the upper left corner, these are nasal cones. This is the mute appliance, which we're going to spend some time talking about. This is ultimately what I'm recommending. I think these are called Flomax nasal dilators, what have you. But you can see there's lots of different ways of doing it. Breathe Right strips have been around for a long time. The goal here is to mechanically open the nose, not pharmacologically. Mute nasal dilators have been on my radar screen for quite some time. Long story short, I do think these are superior. A few lives have been changed already since starting to use these. I just think the technology that went into the design here properly expands the nose for most people to get the maximum impact. And again, these are over the counter. You can buy them on Amazon. I don't know if you can get them at local pharmacies, but I'd imagine they're available somewhere. If not, Amazon.com definitely has them. That's where I've gotten mine. Breathe Right strips. I've used these for quite some time. I don't want to say they're necessarily inferior, but for me, they are. I would encourage everybody to try different things and see what works. Breathe Right strips come in different colors. There's clear, there's skin colored, but they definitely have a positive impact. So I would encourage people to try these out. And here is my favorite ENT on YouTube. Vic Veer is an ENT out of England, and he talks a little bit about different nasal dilators. So I wanted to import his video. So let's take a look at what he has to say about all the different nasal dilators, and then I'll let you know what I think.
Hi there, my name is Vic Veer. I'm an ENT consultant surgeon that works for the National Health Service in England. Today I want to tell you about nasal dilators. Nasal dilators open up your nasal passages so you can breathe better. So it's a bit like doing this. You put your nose like this, it looks rather unattractive, but if you do this, you can breathe a little bit better. Another way to do it is do this. You can just breathe a little bit better. And the idea is that those people who've got a twisted nose, or when you look up their nose, I might show a close up of this part of your nose collapses in, like that. In those situations where your nose keeps collapsing in or your nose is twisted, and what you're trying to do is improve the passage of air through your nose, these nasal dilators, and I've got a few here, there's this one, Better Sleep, and Air Max. What I'm going to do is go through these devices and show you the pros and cons of each of them. Now, the idea behind these nasal dilators is that you're trying to open up the nasal passages so you can breathe preferentially through your nose. Even though you can now suddenly breathe through your nose, it doesn't mean that you'll magically switch over to nasal breathing at night. Some people just carry on breathing through their mouth even though they can breathe through their nose. So you need to train yourself to breathe through your nose again. In some people that means wearing a chin strap, like a rubber band or something that keeps your mouth closed. We can use mouth tape to keep your mouth closed. And once your mouth is closed, a lot of people stop snoring because of that. I do have to caution you, however, if you have obstructive sleep apnea, forcing your mouth closed is probably not the best idea. If you remember, with sleep apnea, your oxygen levels do drop. And if your oxygen levels are dropping, and then someone tells you to keep your mouth taped closed, what you need is oxygen. And if you're closing up your mouth and trying desperately to breathe through your nose, that's not going to be enough. If your oxygen levels are dropping and you're going blue, you want to be able to breathe through your mouth. There is some research on this, and I'll show you some of that data now. So this paper in 2016, written by Carmaccio again, shows that internal nasal dilators seem to improve sleep apnea by very little. It decreased the AHI by 4.87, but if you think about it, if you're mild already, 4.87 really helps. There are also a lot of other papers around which show various benefits of nasal dilators. My take on all these papers put together is that nasal dilators improve your quality of life and have a variable effect on snoring and sleep apnea. And considering these devices are so cheap and accessible, my reasoning is, why not try them? So what I'm going to do is start off with the Better Sleep device, and where you get a whole pot full of these nasal dilators. I'll show you a close-up of that as well. And for example, one of them is like this. It's a solid type ring or tube that gets inserted into your nose. So put this in a bit like this, and you have to push it back far enough so it pushes round there's a bit of cartilage that just runs along here. You need to make sure it goes around there. And then once it's right the way through, you should be able to breathe a little bit better. Like I said, it looks silly. You're not meant to walk around with it all day, but the idea is that when you go to sleep with your nose opened up like this, you can breathe a lot better. You don't need to use sprays and things like that. The bad thing about these things are that you have to remember to put them in every night, and in the morning you need to give them a clean because they get quite crusty, particularly if you look at the other side of the Better Sleep ones. These have got these sort of rings or holes in the middle of them, and when you put these up your nose, I'll show you this. Again, it works quite well. It's not perfect, it doesn't block up your nose quite as much, but a lot of patients say to me once they've used these types that you get a little bit of crust or basically bogey stuck inside here, and that causes sort of an icky sort of sensation like, oh God, that's very disgusting, you have to keep it clean, and that crusting is not particularly pleasant to have to deal with. Now I'm going to go on to the AirMax device, which according to the box has nothing to do with snoring, but it's advertised on Amazon for snoring for some reason. And this is mainly for performance or sports and things like that. So you get two of these devices here, a small and a medium. The medium seems to work better for me, and it works a bit like a V that opens up your nose that way. If I put it in my nose like this is a little bit more fiddly than the other ones. Again, you have to get it past that cartilage, which is down the side here, and you'll feel that it just goes past, and once it's in the right place, it suddenly feels a bit more comfortable, and you can breathe a bit better. Now, I think, for me anyway, this feels like I can breathe a lot better through it. So these work quite well. It does seem to press a little bit in the middle here, because what you're doing is these flanges here are pushing outwards, but also pressing on the mid part of your septum, which is a bit sensitive. This is the most sensitive part of your nose. The side bits aren't so sensitive at all. Now the other product I want to show you is Mute, which has got lovely packaging, and they come out with three of these, small, medium and large. And the difference between these ones is that you can actually titrate or calibrate these as well. So you can customize the amount of spread you do with your nostrils. So you can make this bigger or smaller as you wish. Now for me, I think the medium works best for me. So you need to put it in a little bit at this sort of angle like that. I don't know if you can see that. And just push it in and then rotate it once you've got it underneath that cartilage. Now this is the most fiddly to get in the right position. But when it is in the right position, it gives you the best airway as far as I'm concerned. And it may be because I've customized it and pushed the lateral walls as much as I could. There is still that little bit of pressure on the septum, which at the moment isn't causing me much harm. It's not irritating me too much. But I know some patients later on have a little bit of an abrasion inside their nose. It can cause nosebleeds. I wouldn't try these sorts of dilators if you tend to get nosebleeds. But the airway from this Mute device, I think works the best for me. Sorry. Now there is a different type of nasal dilator, also known as a nasal splint, and instead of pushing something up your nose to do this to you, it sits outside and opens up this way. Let me show you. I think everyone pretty much uses Breathe Right. It opens up the nose, and I think a lot of sportsmen, footballers tend to use it as well. And so you get what looks like a bit of a plaster with a relatively firm middle part. And what you do is you're aiming for this part of your nose here, the depression on both sides. And this goes over the top of your nose. So aim it just about there. And what you're doing is opening it up like that. And you can see it does lift it up away from the midline partition without something going into your nose. So if you're prone to nosebleeds, for example, this would be a good one because it's nothing going up into your nose. The other problem with these strips is that you could be slightly allergic to the glue here. So some people wake up with a bit of redness across here. Sometimes if you use it for a long time, you get a little bit of a red mark across here. because it's pressing on your nose, and they can cause some skin irritation to the bridge of your nose. So in conclusion, there are lots of different types of nasal dilators out there. It's sometimes worth trying these relatively inexpensive devices just to see if opening up your nasal airway helps your snoring. Anyone with a blocked nose will end up breathing through their mouth, say if they've got a cold or something, and most people then snore. Well, I hope you found that useful. The links to all of these products are in the...
All right, so I hope everybody found his stuff insightful. He has a whole series of videos in the ENT world. We have another video coming up from him talking about pharmacotherapies, which is our next topic. So again, there's several different ways to attack the poor nasal breathing concept. The second being using medications to decrease the thickness of the membrane inside of the nose. A membrane is essentially a almost like a balloon that lines, or you can think of it as a balloon that lines the inside of our nose, and under certain conditions the thickness of that balloon increases. As that thickness increases, it decreases our diameter for breathing, or the cross-sectional surface area at which our body is able to actually breathe. So if we can use things to decrease the thickness of that membrane, we breathe better. So many ways of doing this. I would encourage you to talk to your ENT. Yes, your primary care can provide some insight here. I've found a very large distribution in the knowledge of the importance of nasal breathing with our primary care physicians, unfortunately even in the ENT world. So my recommendation is that you talk to an ENT. But do as you may. These three tools here are going to be part of our protocol, with the purpose being these are all pretty straightforward with little side effects. As you get more complex in the pharmacotherapies, you might have more long-term issues, which is not what my role in this is. This is triage care, very low risk, high reward type approaches. If you have allergies is one reason why we may have a thickened sinus membrane. There's lots of different ways going about this. Again, this is not my area of specialty. I am not qualified to provide insight here. I'm just trying to get you to understand that if you have poor nasal breathing, there's all kinds of different reasons why, and there's all kinds of different approaches to treat them. I did want to make a special comment about these two products, Afrin and Sudafed. These are known as nasal decongestants. You can use them, but they're not part of our protocol. Our protocol is to give you 3 to 4 to 5 months of a protocol that you can use predictably with very low side effects until you see your ENT, at which time maybe the ENT will recommend one or two of these. The reason for this is you can get a rebound effect where these medications don't actually work as well over time, and then you become dependent on them. So keep in mind that these become somewhat addictive. Maybe addictive is not the right word, but our body becomes physically dependent upon these, and I don't want to create a problem. So I would reserve use of both Afrin and Sudafed for severe colds where you can't breathe. We're only going to be using these for 3 to 5 days. That's fine. They're over the counter, so you can use them. But our goal here is a long-term, low-risk approach. So we're going to avoid these for now. Let's see what Dr. Veer has to say about pharmacotherapy.
Hi there, my name is Vic Veer. I'm an ENT consultant surgeon working in central London for the National Health Service in England. In this video I'm going to tell you all about nasal sprays and how to use them correctly, because there's really no point taking a nasal spray, getting all the side effects and none of the benefits. So in this video I'm going to tell you 5 tips and 1 bonus tip at the end of how to use these things properly. So the first thing you have to remember is that for this spray to work, it needs to go up into your nose and stay in your nose for it to work. This seems very obvious, but I see an awful lot of people when they use the spray like this, and then they go and snip it right up. And then you end up tasting it and it all goes away. So the first tip is really, if you spray this up your nose, do not sniff straight away. Leave it in your nose for it to work and for it to sort of marinate inside your nose. The longer it stays in your nose, the longer.
I have found pinching my nose to be very helpful. I find when I spray, no matter what I spray, I want to sniff. It's almost like when you take a cough drop, it's hard not to chew on it. Your body just, for whatever reason, wants to react a certain way. So when I spray, I just pinch my nose and I let it sit there for 30 seconds. You may or may not need to do it, but just an idea, something to consider.
The longer it stays in contact with the lining of your nose, the more it will work, the better it will work for you. So now we're on to tip number 2. If you're going to spray these sprays up your nose, you need to make sure the spray actually touches the lining of your nose. It doesn't touch the mucus or the bogey or whatever else is in your nose. So what I recommend you do is you clean out your nose of all the mucus and all the debris inside your nose using some salt water or like a hypertonic Sterimar, which is what this is. If you've got sinus problems, I'd use NECADE sinus rinse, and I'll leave a picture of it just here somewhere. Don't use water, obviously, because water makes your nose even more congested than before. But the idea is that you use the salt water to flush out all that mucus. So
some of you may be thinking about a neti pot. I'll defer to the ENT to decide whether a neti pot is right for you or not. Yes, neti pots can clean out the sinuses, but our protocol, which we're trying to develop, which is super safe yet still effective, we're going to rely on hypertonic saline nasal sprays. NECADE is one of those. You can get a whole bunch of those over the counter from Walgreens or pharmacies closest to you.
So when you eventually do go onto your spray, when you spray it and you don't sniff up, when you spray it and it stays in your nose and it sits on the actual skin, not on the mucus, because you're not trying to treat the mucus, you're trying to treat the actual lining of your nose. So now we're on to tip number 3. What we're trying to do is get the spray up into your nose and hit the areas which are most likely to swell up and cause you blockage. You need to know a little bit of anatomy for this. This little part here in the middle is called the septum, or the midline partition of your nose is the septum. And that doesn't really swell up an awful lot. The areas that do swell up are actually on the sides, on the outside or the lateral part of your nose. And in this area you have things called the turbinates. The turbinates are a bit like gills when you see them side on. They're these things that come in, so if you've got the side wall of your nose like this, and they come in like this. There's an inferior, middle, superior, and even a supreme. So sometimes there are up to 4 of these sort of outpouchings, or just sort of areas which look like gills on the side. And these swell up and shrink down depending on how fast you're breathing in, if you're allergic to anything, or even what side you sleep on. If you sleep on this side of your nose will open up, the turbinates will shrink down, but the turbinates will swell up on this side. If you slept on this side, however, the opposite happens. Sometimes if you press on the side of your arm here, it's called an Epley's reflex, that can cause your turbinates to shrink down on the other side. It's a very weird reflex. There's also something called a nasal cycle, where the turbinates take it in turns to swell up and shrink down. But that's beside the point. What I'm trying to show you is that the spray should be getting to the turbinates which are on the side of your nose, not in the midline. So when you spray this up your nose, what I recommend is that if you're spraying into your right, this is my right nostril, you use your right hand and you point it towards your ear. So you're pointing it that way towards your ear, because you're trying to get it to the turbinates which sit laterally, or just near where this bone is here. You're not trying to put it directly back or directly up. Going up doesn't make any sense at all, because there's nothing up there. You breathe through the bottom part of your nose down there, not up there. And when you're going on to the left side, you change hands, so your left hand for your left nostril, and then you can point it towards this ear again. So it just naturally, your hand sits in that position, which means that it points the right direction. Again, before you spray, clean your nose out firstly with this, and spray, and don't sniff it up. Leave it in your mouth, breathe through your mouth afterwards. Don't go, because then by the time you taste it, it's all gone. Now, some people may be taking steroid sprays because of polyps that can occur inside your nose. Now, this is actually between the inferior and the middle turbinate. So in that little space between the two, polyps arise from that area there. You don't get polyps arising from the septum of your nose. So again, this works for people with polyps as well. Aim it sort of that way towards your earlobe, just about here. The better you direct these sprays and you don't sniff it up and you clean it out beforehand, the better you do that, the less chance there is for you to need an operation or to have your polyps removed again. So tip number 4, do not sneeze directly after spraying this up your nose, because all of that good stuff is going to come out and you're not going to get treated as you want to be treated. Now, this may be easier said than done, but a trick to stop you from sneezing straight after doing this is that if you feel a sneeze is about to come on, press very hard here, just underneath your septum or just underneath the nose, just here. Press hard against the top teeth and press really hard so it slightly hurts. That will get rid of the sneeze, so that the urge of a sneeze will just go away if you catch it early enough like this. Some people just press straight away after spraying this because they know they always sneeze after putting the spray up their nose. That little technique of pressing hard here is quite useful as well if you've been told after an operation, look, don't sneeze or try and sneeze with your mouth open because you may start bleeding. All you have to do is press very hard here and the urge of sneezing will just go away. So we're on to tip number 5 now. We're nearly to the end. You need to make sure you're on the right spray for your problem and make sure you're not taking too much of the wrong spray. So for example, decongestants such as Sudafed and Otrivine, you can only use those for about 5 to 7 days.
In America, Afrin is the most common brand name for this particular kind of decongestant.
If you use them any longer than that, you'll get something known as rhinitis medicamentosa, which means that your nose sort of becomes addicted to it. You keep using those Otrivine type decongestant sprays, eventually your nose gets more and more reliant on it. And you'll find that the effectiveness of these decongestant sprays get shorter and shorter and shorter. So initially, oh wow, this spray worked for 8 hours. But if you use it for longer than a week, you'll find that, oh, actually it's only lasting a few hours now and I have to keep using it. And you end up using it all day, every day, spraying all the time. And what's happening is that your nose, the decongestant stops all the blood flow that goes to your nose. This works brilliantly if you've got a cold for a few days. And you can use the decongestant spray during a cold or during sinusitis just to open up your nose very quickly. But the problem with decongestants, if you're not letting any blood go into your nose gets desperate for oxygen. So as soon as the decongestant effect wears off, the blood pours back in, your nose sort of swells up and you can't breathe at all. Then you reach for the decongestant again to try and get that spray to work again, trying to unblock your nose. You get into a horrible cycle where you're constantly trying to clear your nose and you're using the Otrivine more and more. Eventually you're sort of addicted to it. So if you end up using decongestants a lot, you get some of the side effects people commonly see with people who use too much cocaine. So just don't use it for more than 4 or 5 days. It's really important. And it protects your nose from getting this horrible problem, rhinitis medicamentosa. So some of you have been given some steroid sprays for your nose, and some of them are very good, some of them aren't so good because you can only use them for about 3 months at a go. So these are some of the names of drugs that you can't use for more than 3 months. Otherwise, you get some of the long-term bad effects of using these steroid sprays. Because the steroid doesn't just stay in your nose, it percolates through the rest of your body, give you side effects for your whole body rather than just staying in your nose. So some of these sprays that you can get, which you only should be using for less than 3 months, are the equivalent to taking oral tablets of steroids, and therefore
it's important to understand he's not talking about Flonase. He'll talk about Flonase in a moment. Flonase is a steroid, but it's a low-dose steroid that can be used indefinitely, and that's why it's over the counter now. What he's talking about are prescription nasal sprays that are steroids. These would only be prescribed by your doctor or your ENT.
You can get all the side effects of steroids, and I'll give you some of the list of things that can happen to you here. There are some steroid sprays out there which have very low bioavailability. And what that means is that when you spray it up your nose, it just stays in your nose. It doesn't go through your whole body. It doesn't give you side effects throughout the rest of your body. And that's why you can use them long term. So this spray here, Pyranase.
This is Flonase in America,
which you can buy from Tesco or any supermarket, is also known as fluticasone propionate. And this spray is quite safe. That's why you can get it over the counter, whereas you can't get some of these other sprays I was telling you about. And people have been on these for decades and have not had many side effects at all. So they're much safer than the other drugs, which basically are just taking steroids. So now the bonus tip. Now the reason why it's a bonus tip is it's not really a nasal spray I'm telling you about. It's about something called Flixinase nasals. I'll leave another picture of it up there. Now this is sort of like fluticasone propionate, slightly different. And what you get is a little ampule of this stuff, like a little canister, and you pour this into your nose. I see an awful lot of people sort of doing this, where they pour it up their nose like this, and it goes down the back of their nose and goes straight into their throat. Doing that is never going to work because, again, you know that it needs to stay in your nose for as long as possible. If you're going to use a very strong drug such as Flixinase nasals, you need to stay in your nose for as long as possible. So what you're meant to do is get into a Muslim prayer position, it's called. What you need to do is turn your head straight upside down, right around, so your nose is, the nostrils are pointing up towards the ceiling. It's quite hard to do. And then you pour the stuff into your nose with your nose straight upside down, and then you fill up your nose and hold it in your nose for as long as possible. 30 seconds, few minutes if you can tolerate it. The longer that stuff stays in your nose, the better it'll work. If you just do this, you'll notice it'll just go straight into your throat and it's gone. It's pointless if you do that, and you're probably getting the side effects of taking steroids as well. Keep it in your nose for as long as you possibly can. Hi there, my name is Vic Veer. I'm an ENT consultant surgeon.
So that final one, we're not going to talk about at this point. I don't have any knowledge about that particular product. Essentially, it's like Flonase, but a liquid. So it probably works in a slightly more profound manner because a spray is less likely to stay. Would be my thought. With that said, Flonase is our current method for this particular approach. So the triage care algorithm that we're going to use until further notice is to use the mute nasal dilators for a mechanical means of opening up the nose. I have no doubt you're going to notice an improvement in your ability to breathe. We're also going to use Flonase steroid sprays one time at night before going to bed, and then improving nasal hygiene through saline rinses such as the NECADE, and then using a xylitol nasal spray called Clear or Xlear. Essentially is a antibacterial approach to keep the nose clean. And that's these 4 things here. I will be putting together some packages and putting them at the office. If you just want to stop by, you can buy all 4 of these. Our goal isn't to make any money on this, so we'll have it at cost. Our goal is to improve your quality of life. With that said, you can obtain all of these on Amazon. I'm sure Walmart.com. With that said, if you're more comfortable just kind of getting a package with some directions, we will have that available to you in 2022, which is today. And here are the directions. This may change over time. You can customize it based upon what you think. This is where my head is at and what has worked well for me. I use the Clear spray 3 to 4 times a day per nostril. There is no long-term effect here. Xylitol is very bio-friendly. We use xylitol for all kinds of purposes in the mouth to kill bacteria. It's a sugar at the end of the day that happens to kill bacteria. And is very important for decreasing nasal congestion and getting a cleaner nose. I say not to use it with Flonase only because when you use Flonase, you want that to be the primary drug that's sitting on the nose when you spray it. So use the Clear 3 to 4 times a day. Don't use it at the same time as the Flonase. What I typically will do is 10 minutes before I go to bed, I'll spray with the saline nasal spray. I've started playing around with nasal gels, which are slightly more viscous versions of it. The point is I'm cleaning out the nose with the saline 10 minutes before the Flonase, and then I spray the Flonase in. Sometimes I'll blow my nose, depending on how much mucus I think might be up there. My goal is to have a clear sinus so that when I spray the Flonase, it's not going to end up landing on mucus, or bogeys, as he called them. And then I'll put in, I'm wearing my mute nasal dilators. I've been wearing Breathe Right strips nonstop for 2 months. I can't live without them. I've now switched to the mute nasal dilator. I say wear it as much as possible. Do as you may. In the world of wearing masks, I don't think it really matters. There are some people you're just going to find that your quality of life drastically improves when you wear these, but you definitely want to wear them during sleep. There's a whole arena of how this affects our ability to sleep better. That is a huge reason why they improve your quality of life. If you're going to choose an 8-hour window, use the 8-hour window that you sleep. With that said, my recommendation is to wear it all the time. And then during this time, during this triage phase of treatment, find a good ENT. So again, there was a hierarchy of care here. This has to be very clear. I'm not recommending this be treatment because I'm not qualified to treat this area of your body. Your ENT specialist is. So you need to go find an ENT. Here's a statement that articulates why it's important to find a good ENT. But suffice it to say, we are currently creating a team for this purpose, and we'll notify everybody once we found the right ENT team. I have two names. I can't say that these are the perfect people. I do think Dr. Peter Catalano down in Boston, he's written a lot of papers on the importance of nasal breathing. I'm actually going to see him next month, so I'll have a lot more insight at that point in time. But I do think he's somebody worthy of the trip. And then there's also Dr. Roediger. I've heard lots of great things about. I do believe he understands the value of nasal breathing in our overall health more than most ENTs. You would think that all ENTs understand this stuff the same. They don't. I have spent a fair amount of time reading the otolaryngology literature, and I'll say they're in the early infancy of understanding how to surgically treat the nose to increase nasal breathing, because we're only starting to understand how important nasal breathing is in the bigger picture. So there's a large variety of opinions out there. That's why we are going to burden the responsibility of finding the right people to dovetail what we're trying to do, which is to create an oral cavity that supports proper breathing. So you might have wondered why I'm a dentist talking about all this stuff. There's a much bigger picture here that we're trying to paint, and you'll see over time. With that said, this whole nasal breathing concept of triage care is a great place to start. So on that note, happy breathing. If anybody has any questions, let me just show you my email. I'm going to type it in right here. So Dr._Roy at Saco River Dentistry.com. So feel free to reach out anytime. I will do a new video once this information becomes updated. And we look forward to helping you on your journey to a better quality life. Happy 2022, and look forward to chatting with you all. Take care.